General anesthetic. First, classification. There are two main classifications for general anesthetic. It is inhalational and IV anesthetics. Inhalational anesthesia divide into again into gas and liquid. Gases are nitrous oxide and cyclopropane. Liquid are halothane, enfluorine, isoflurane, desflurane, ether, and xenon. And IV anesthesia for inducing we use thiopentone sodium propofol. For dissociative we use ketamine. For opioids uh, we use fentanyl, and benzodiazepine we use DLM. It is diazepam, lorazepam, midazolam. And what is the mechanism of action of general anesthetic? It binds to adjacent GABA receptors and increase frequency of binding GABA receptors and increase the activation of GABA receptor. That we know GABA is the inhibitor neurotransmitter. When it is released, so excitation will be reduced. So the pain sensation will be reduced. And enhance ligand gated chlorine channel. We also know that when chlorine channels are open, when they are going inside, they will neutralize positive ions in the neurons. It will cause to inhibitory action in the synapses. And ketamine and nitrous oxide inhibit NMDA receptor. NMDA means N-methyl D-aspartate receptors. They are primary excitatory receptors. So ketamine and nitrous oxide primarily do is they block these NMDA receptors and also bind to potassium channels and activate them. When bind to potassium channels and activate them, it will cause hyperpolarization, and again depolarization won't be happen. So factors determine the efficacy of general anesthetic. It is the boiling point and the induction, pulmonary ventilation rate, partial pressure, and alveolar blood flow. And the recovery depend on there's a concept called minimal alveolar concentration. This is nothing but it is anesthetic concentration in alveoli need to eliminate pain in 50% of the patient. So this is what is called minimal alveolar concentration. It is the anesthetic concentration that we need in alveoli to eliminate pain in if you take 100 uh, patients. So what concentration do you need to eliminate pain in 50%? uh, so that is we call MAC, minimal alveolar concentration. uh, as pre-anesthetic medication, we usually don't introduce into patient's body only these nitrous oxide or gases or anything. So we are doing in major surgeries, we use some pre-anesthetic medications such as to relieve medication. There we use diazepam and lorazepam. They are mainly to relieve the anxiety and the reduction of secretion vagal. We you have to use anticholinergic drug. Normally we use atropine, and reduction of pain we use morphine and fentanyl. And there is a tendency to vomit. So we don't want to do during operation or after operation. So we use antiemetic, like mostly we use metoclopramide and ondansetron. And when you're talking about general anesthetic, you have to know uh, some anesthetics and their contraindication and advantages. In here I got mainly nitrous oxide. There are two kind of solution that we could use. There's a 50% nitrous oxide and 50% oxygen, and 70% nitrous oxide and 30% oxygen. So there is differences in 50% nitrous oxide and 50% oxygen. They will cause euphoria, sedation, analgesia similar to morphine. Indication: post-op analgesia, narcosis, and acute pancreatitis, and gynecological ones. And complication, there will be thrombocytopenia. Thrombocytopenia. There will be tendency to bleed and agranulocytosis. Um, Next, 70% nitrous oxide and 30% oxygen. The mainly we achieve by this is analgesic effect. Normally, we use this proportion for surgical manipulation. There are complications like hypoxemia and cardio depression. Cardiac arrest could be occur. They are contraindicated in AR. In embolus, if patient is having pneumothorax or emphysema to patient, or patient having bowel obstruction or decompression sickness, this nitrous oxide is contraindicated because they will try to increase the volume in trapped air, and it will increase the symptoms. And just imagine in bowel obstruction, the proximal to obstruction, imagine they say atresia somewhere in small intestine, proximal to then there is a air accumulate, and for surgical manipulation you give nitrous oxide, and nitrous oxide will cause to increase the volume, and um, introduce pressure into that bowel lumen. It will try to like um, it will be large as a balloon, uh, like that. So when you introduce nitrous oxide into air, it will try to like what we inflate, that's a proper word, inflate. So it will increase the it will cause complication, and it will cause complication, actually it will cause complication. And advantages of nitrous oxide are non-irritant, non-flammable, rapid action and rapid recovery. Disadvantages could be a little the low effect, maybe low effect comparatively. So if someone asks why can't we use nitrous oxide in pneumothorax, because it will cause um, the trapped air into inflation, the trapped air into inflation. It could worsen the condition. That's why mainly in decompression sickness as well, you can't use nitrous oxide. Pneumothorax, emphysema, bowel obstruction, do not use nitrous oxide. If a patient having embolus, do not cause, because embolus will be bigger in bloodstream, uh, so more complication. So you generally you have know what is about general anesthetic, what is the classification of general anesthetic, what is the mechanism of general anesthetic, and what are the example for general anesthetic, what are the pre-anesthetic medication that we use with general anesthetic, what are the good qualities that we expect from a good anesthetic, from good general anesthetic, what is minimal alveolar concentration, that concentration is need to um, go 50% of uh, patient to anesthesia. So that is minimal alveolar concentration. And when you talk about pre-anesthetic medication, you have to know what are the drug we use, for what we use. For relieve anxiety, we use diazepam and lorazepam. For reduction secretion and vagal reflexes, we use atropine. Why reduction secretion and vagal reflexes? Due to when you uh, first one is to reduce secretion is to reduce post-operative pneumonias, because if surgery is going more long time, there will be more accumulated secretions. The bacteria could grow in that. So after operation, pneumonia could develop. So we do not need that. And for to reduce vagal reflexes, to reduce vomiting and antiemetic medication. So when you are in intraoperatively, when you are doing operation, and if patient suddenly vomit, it will cause aspiration, and it will cause complications like aspiration pneumonia. To reduce pain, morphine and fentanyl. So what are the kind of nitrous oxide we have, what are the main effects, and why are the nitrous oxide is contraindicated, what is the advantages, what are the if you know these things, this will be more than enough for general anesthetic.